Hello everybody, namaste and a very warm welcome. How are you doing? कैसे हैं आप लोग? You can quickly type it in the chat box. Please tell me if my audio is okay, video is visible. मैं ठीक से दिख रही हूँ, अच्छे से सुनाई दे रही हूँ. And without any delay, if everything is okay, I would like to invite ma'am so that we can start with the questions. आपने बहुत सारे questions भेजे हैं हमको हमारे टीम को. So we would not like to do any delay and let's invite ma'am. Hello ma'am,
Yeah.
namaste.
Namaste. Namaste. Namaste, everyone.
Sorry ma'am, just checking one. बैक एंड टीम एक बार ही आप लोग वो ऑडियो सेट लेआउट सेट कर दीजिए. Ma'am, the first question is about urine leakage. Is it aimed only for women? Do the exercises mentioned work for both women and men?
Yeah, both men and women. The exercises are not for only the women. Everything, the rules and how to do the exercise, that is 20% contraction. Everything works for both the same.
The next question is somebody saying that I could hold both my legs for 30 seconds. My age is 63 years. I think it's for the day 2 balance test.
Yeah.
मैम द नेक्स्ट क्वेश्चन इज मेरे हील्स में 2 days से चलते हुए पेन है. प्लीज टेल एंड सेशंस हिंदी इंग्लिश मिक्स कीजिए. मैम आई थिंक हील पेन पे थोड़ा एक्सप्लेन.
हाँ, तो देखिए, अगर फ्रेश हिल पेन है, आई विल टॉक दिस इन हिंदी ओनली. अगर आपको हिल पेन है 1-2 दिन से, तो सबसे पहले तो आपने आपकी शूज जो रोज पहनते हैं घर में या बाहर में, वो चेक करने चाहिए. कहीं पे वियर एंड टियर है क्या, कहीं पे ज्यादा बॉडी वेट जा रहा है क्या. द फर्स्ट थिंग. सेकेंड थिंग, आई थिंक यू कैन टेक पानी की बॉटल लीजिए, उसको फ्रीजर में रखिए. गोल पानी की बॉटल, पानी भर के फ्रीजर में रखिए. अंदर बर्फ जमेगी, उसके ऊपर पैर 5 से 7 मिनट रोल कीजिए चेयर पे बैठ के. रूल नंबर 3, आप गैस्ट्रो स्ट्रेच जो हमने फर्स्ट डे किया था, गैस्ट्रोनीमियस नाम का एक मसल होता है काफ में, उसका स्ट्रेच, और अपना जो पंजा है उसको ऐसे खींच सकते हैं, पूरा होल्ड कर सकते हैं 30 सेकेंड, वो कर सकते हैं. और नेक्स्ट है जो आप कर सकते हैं कि टॉवेल रख के आपकी उंगलियों को ऐसे खींच सकते हैं. ये सब चीजें कीजिए. बट अगर पेन, हिल पेन, अगर आपका जो हम लोग कांस्टेंट होलिस्टिक अप्रोच बोल रहे हैं, बॉडी चेन बोल रहे हैं, द पेन इज ड्यू टू आपके कोवर लेस स्टेबलाइज होते हैं, आपके हिप गर्डल वीक है या नी वीक है, तो फिर ये पेन आपका नहीं जाएगा. आपको पूरा एक साइंटिफिक अप्रोच लगेगा.
Thank you, ma'am. Ma'am, the next question is around the tests. तो उन्होंने अपने day 1 goal test, my result is 9 inch. Day 2 goal test, balance on left leg 2 seconds, right leg 3 seconds. What precaution can I take? What exercise can help? Please help. My age is 75 years. Breathing exercises shown by Dr. Sheetal on day 1 to be done only for stress and sleep problems or to do regularly?
I will answer one by one. See, day 1 test, day 2 test, balance and strength is less. So first I will tell the precaution. It is very important because these values will take some time. Your room should be clutter free. At night, if you want to go to washroom, there should be some light or something. So there should not be any fall, right? Second, whatever area you move in the house or wherever you go, try to avoid the areas which are not very known to you, like the depth perception goes down and all because of that. Next is you start working in a pain-free range. I'm repeating, the core stabilization, strength of the hip girdle, right? Because that is the end result, strength of the hamstring and the quadriceps. We are going to talk about the balance exercises today. So please listen that slide carefully. I'm going to tell what this does mean by exercises. So these are the things. So clutter-free house, lighted room, and exercises.
Ma'am, the next question. I am 70. Can I do knee exercises wearing kneecap? And for how long should I wear kneecaps in a day?
Actually, first understand what is mean by kneecap. Kneecap is doing the job of your muscle, scientific logic, right? But sometimes in at the age of 70 or 50 or 60 there is a degenerative meniscus problems. मतलब जो गद्दा होता है, मतलब there is a shock up in your knee joint. So these shock ups, there is a wear and tear of these shock ups, and because of that there is some locking, mind locking when you exercise. That time we tell the patient to do exercises with kneecap. Otherwise, what we tell the patient, please don't do exercises with the kneecap, but you can do exercises non-loaded position. Then standing वाली exercise मत करो, because standing में you require a lot of muscle strength. You can do exercises in lying down. You can do exercises semi-loaded position, मतलब sitting में करिए, but don't do in lying down standing position. But minimal use of kneecap.
Dr. Sheetal gives very nice information. My question is, my legs are turning inside. So what type shoe should I wear?
Uh, I brought the shoe today. I will repeat, see, because I was not able to explain correctly. So if your both the feet are going inside, means middle arch is collapsing. If you see this shoe, you can see very well the middle arch. This is my shoe. This is the middle arch, right? So if your inbuilt middle arch don't require uh, inserts in the, because they don't work really well, you have to either fix it or purchase the shoes which have the middle arch, right? And I will repeat the 3 4 things I explained about the shoe. Is, see, I'm turning both the ends and it is not possible for me, they can't come close to each other, there is a less. And if the back side, if you, I see I'm pressing but it is not going, I'm pressing from the down and it is not going close to each other. So this is a good shoe. And you can see the gel also inside. So there's a gel in. So this shoe will work as a shocker for me. So you can decide that. I can't hear, Yamini.
Sorry, I was on mute. The next question is, my problem is in standing position and sitting position, no urge for urination. As soon as I lie down, frequently go for frequently go for urination. I am 58 years old female. Please reply to my problem.
Ideally, you have to go first to the gynecologist, get it checked. Is there any infection or something like that? First, there is a chance of infection or something. Secondly, we need a complete evaluation because bladder will load when you are sitting or standing, right? So if, and bladder is not loaded in the supine position, that is lying down position. So I think the correct answer will be, you have to do one-on-one consultation online, on online platform, and then only I can exactly answer. Because whenever we start also the exercises for a patient who's having incontinence, I ask them to lie down first and do for a few weeks and then do sitting and standing.
Ma'am, there was a question on nerve impingement in shoulder. What can we do?
Ideally, there is no nerve impingement usually in the shoulder. There is a muscle impingement. There are 4 muscles, primary muscles of the shoulder. जैसे हम बोलते हैं, first family circle, second family circle. So there are 4 muscles. Usually they get injured, right? But on a public platform, I can't give you explanation because which muscles got impinged, right? Infraspinatus, supraspinatus, or something like that. So you can book a consultation and you can find your exact answer.
Thank you, ma'am. Um, in respect, okay, I have two questions. First, should exercise for knee or buttocks be done during pain in that area? Two, whether hot fermentation is advisable or appropriate to reduce the pain.
Uh, yeah, when there is a pain in the buttocks and in the knee, you should do exercise because there is a muscle contraction, the toxins will be relieved from that area, but never overdo or never try to do exercises in a loaded position. That is a standing position. Standing position is a loaded position. You can do exercises in the lying down or a sitting where you are not loading your knee joint or a buttocks, right? So I think exercise is must. Second is don't fatigue your muscles. And for example, you are trying to do for the 2 minutes and your body is telling you, no, no, after a 1 minute, your muscles are tired, stop there itself. So, and what was the second question you said in that? I can't hear it again.
Whether hot fermentation is
Yeah.
advisable and appropriate.
Yeah. So I will tell you basic rule for hot and cold. Basic rule, right? When the muscles are tight, do hot. When the muscles are inflamed, मतलब सूजन, use cold. Exercise के बाद pain हो रहा है, use cold. That is soreness or a overdoing or a fatigue you have done, then use cold. And when there is a catch, try to lift something and there is a catch, then you should use hot. But this is very generalized.
Ma'am, the next question is डे 3 ऑफ विमेन हेल्थ मैटर्स बहुत बढ़िया और बहुत उपयोग हुआ मथला मुझे ना कर पाया because my age is 56 I was suffering urine leakage now this exercise बहुत मुश्किल है मुझे 2 या 3 सेकंड कर सकते सौरभ जी कहते स्क्वीज भी नहीं कर पाया ऐसे कर आई एम सॉरी ये क्वेश्चन आप दोबारा से भेज दीजिए मैम आई कुड नॉट फॉलो माय क्वेश्चन माय फीट बर्न्स इफ आई स्टैंड फॉर लॉन्ग टाइम आई हैव फ्लैट फीट आई एम 69 years old and RA patient.
Okay, so RA is an autoimmune problem, and you said you have to get it thoroughly checked, right? What happens in the RA many of the time, people in the RA you have to take the medicine, that is a must, right, with the rheumatologist, and we start exercises and we stop many of the time medicine. So I think regular every year one checkup with the rheumatologist and a regular set of 30 exercises, means medicine and exercise go in hand in RA if RA is positive, right? Second is in the exercises also you have to do 30% of cardio exercises, right? 30%, we are doing to do today cardio exercises 30%. So burning feet, we have to find out first the reason. Is the glucose is the sugar is playing any role, right? What is there? So we have to find out exact reason and then we can do. But first follow your rheumatologist, and the second is do regular exercises.
Ma'am, we will start today's session and then take questions towards the end.
Okay.
Namaste everybody and welcome to day 4. Over the last few days, हमने सारी चीज़ों के बारे में बात की. We've spoken about menopause, sleep, joint pains, and even pelvic health, right? All very very important aspects of women health. और इन चीज़ों को ना ज़्यादा attention भी नहीं मिलती. मोस्टली वी हियर मैनी women से कि पहले मैं यही फूड खाती थी और मेरा वेट मेंटेन रहता था बट नाउ अचानक से वेट बढ़ गया माई वेट इंक्रीजेज वेरी इजीली वी नीड टू अंडरस्टैंड इट्स नॉट जस्ट अबाउट फूड और एक्सरसाइज राइट जब मेनोपॉज होता है तो बॉडी बहुत सारे हार्मोनल चेंजेस गो थ्रू करती है दैट अफेक्ट्स आवर मेटाबॉलिज्म फैट स्टोरेज स्लीप एनर्जी लेवल्स बिकॉज ये सारी चेंज होती है हमारी बॉडी में वेट गेन स्पेशली नियर द एब्डोमेन बहुत कॉमन हो जाता है बट द गुड न्यूज इज राइट मूवमेंट strengthening exercises and daily habits will help us manage this phase much better. And to assist for that, we have none other than Dr. Sheetal Mundra with her 36 years of experience in physiotherapy to help us understand कि वेट गेन क्यों होता है मेनोपॉज में क्या चेंजेस अकर होती है और हम कैसे सिंपल मूवमेंट्स और एक्सरसाइजेस कर सकते हैं जिससे वी स्टे स्ट्रांग वी स्टे एक्टिव वी स्टे हेल्दी हमेशा याद रखना कि ये सेशन इज नॉट अबाउट चेजिंग अ नंबर ऑन वेइंग स्केल है ना वेइंग स्केल पे हमारा कितना मेजरमेंट आता है दैट इज नॉट इम्पॉर्टेंट इट इज इम्पॉर्टेंट दैट वी बिल्ड स्ट्रेंथ हमारी मोबिलिटी इंप्रूव हो और हम अपनी बॉडी को सपोर्ट कर पाए इतने इम्पॉर्टेंट फेज ऑफ लाइफ में right? So let's continue learning and also caring for ourselves. Over to you, ma'am.
Conversations continuously. So, the first thing is everyone, please close your eyes and memorize. Movement is the medicine. We don't have to write. You have to understand the importance of movement. Movement is the medicine. Please remember this every day. Yeah. Now you can open your eyes. What Yamini said very well. Next. What Yamini said very well. Ki these questions comes to us. I'm eating same. Still my weight is increasing. I'm eating same, but my abdomen is getting, like, belly fat is getting heavy and heavy, and I'm very trying very hard, but it's very tough to reduce the weight. And I will tell you, this happens with me also. I have to be highly vigilant for 1 kg. Before 40, it was very easy for me also to reduce the weight, but now even I am trying to manage 1 kg body weight. Like, I have to do so many things I'm shifting, and then I can see the weight on the scale. So I yesterday also someone asked us, right? Craving and the body weight. So this class is all for that. Yeah. Next. On the first day, we understood about estrogen, role of estrogen. So we have to start from there itself, because every weight and estrogen both go hand in hand, right? So as the estrogen reduces, muscle mass also goes down, right? Fat storage shifts to the abdomen. We understood on the first day that insulin tolerance also goes down. Insulin resistance increases, slightly increases. Recovery reduces. आप लोग बोलते हैं कि पहले मैं इतने जल्दी ठीक हो जाती थी ये ऑपरेशन में, अभी ज़्यादा टाइम लग रहा है, चाहे फिर वो सिंपल बैक पेन हो या फिर एनी इंटरवेंशंस, राइट? एंड द स्ट्रेस, यू आर नॉट एबल टू कोप अप द सेम सिचुएशन विद ग्रेस. सो दीज ऑल थिंग्स आर कनेक्टेड टू योर एस्ट्रोजन. So what happened, like, after 40 is the muscle mass goes down. So these are the things I will tell you. The muscle back में जाइए. Yeah. So first we will talk only about the muscle first, because muscle also gives us movement. Because of the muscles we are independent. So the less muscles, right, after 40 you have to make the efforts to maintain those muscles. Because of the estrogen, less muscle mass. If the less muscle mass means resting metabolic rate, means you are not doing anything, but still आपका metabolic rate काम कर रहा है and वजन कम हो रहा है. So that mechanism also goes down, right? Means more weight gain. And second vicious cycle is, because of the less muscle, your activities become painful, because muscle strength nahi hai. You can't stand for a long time, you can't bend for a long time, you can't walk for a long time, and because of that also you're eating same and the weight gain is there. So muscle mass directly and indirectly affect your weight, right? That is obesity, right? Second is the insulin sensitivity. The body that less efficient at holding the glucose and after menopause. So what happened basically, blood sugar spikes are very higher. After the menopause you will see the like the spikes are very higher. The fat storage, again, it is very easy to store the fat in the body, right? And the energy crashes also are there, and all this leads to the sugar craving. So you have seen either the old people or after the 40-45 you feel like going and eating something sweet. This is very higher. Some people develop the habit of evening snacking and energy drops. Irrespective of you are eating everything, still you are telling मैं थक रही हूँ, मैं थक रही हूँ, right? So all these things is because of your insulin sensitivity. And second, now is the abdominal fat. We talked about cortisol, estrogen is going down, and body doesn't understand that where to store the fat. Before the menopause, usually your fat is stored around your hips and thigh. But now, as the body doesn't understand, your all fat is accumulated around your abdomen, right? And that fat is called a visceral fat. This is very risky fat. All many health issues comes due to this visceral fat. And because of the central obesity also, what happens, your all abdomen is coming forward and there is a lot of arching in your back. And because of arching in your back, your abdomen is very heavy and lot of load is coming on your back. Even the back pain starts, sometimes the knee pain, sometimes the back pain is due to this central obesity. Due to the central obesity, there is a lot of research is there that even the heart issues, as I said, the visceral fat, heart issues are also connected due to the central obesity. So then there comes the stress and the sleep, right? We talked about muscle, we talked about insulin sensitivity, we talked about central obesity, that is fat accumulation, यानी पेट में fat जमा हो जाना, right? Now we said कि estrogen is going down, it regulates your stress hormone cortisol, and as the stress hormones remain same and the stress levels goes up, right? So even this hormone cortisol also increases the abdominal fat storage. Means there are 2 3 abdominal fat storage are there, right? So because of the glucose sensitivity, because of the cortisol, then I will say the less activity, so many things are accumulating the fat around your abdomen. Because of the stress, the inflammation increases, right? Inflammation increases means maybe you are exercising just for 10 minutes, 20 minutes, 30 minutes, and that soreness will be there for more longer time. Or if there is an inflammation, recovery time is very slow, right? As we said, because of the stress, there is a lots of craving, and more craving, more eating, more eating, more weight gain, and even the disturbed sleeps are there, right? Because on the first day we understood sleep and stress cycle, vicious cycle. Stress, then sleep, because of less sleep, again the stress, right? And because of the poor sleep, one more thing happens is the hunger hormone. Ghrelin is the hunger hormone. It also increases and you feel more hungry. That's why you have seen the people are eating more at night, right? And again, more accumulation of the fat. So but what can we do something? In the starting we said movement is the medicine. On the first and second day I said write 2M, right? But here the 2M are different. Movement is the medicine. First M is the daily movements. Daily movements ka matlab hai you are getting up from the bed, many of the time you are getting up from the dining table. For small small things you are getting up, that is the movement, right? And the second M is the exercises. So what is this? We undermine lot about a daily movement, right? We hire many house helps, right? We use drivers. We don't nowadays we buy vegetables also online, grocery also online. So we hardly move out, we hardly lift the weights. See, if we are going to the for example vendor and you are purchasing the vegetables, you will bend forward, you will lift the bags and you will carry those bags. That is a exercise for flexibility, the strength, for the bone health, for the muscle health. Same way you are going to the grocery shop, saying same, lifting the weights and carrying those weights and coming to home. Again, lot of weight bearing on your bones and the muscle, that is a weight bearing exercises, right? We have stopped sitting on the floor. Definitely if you are healthy, then only please do this. Don't do it if it is a painful or a doctor has not advised. But sitting on the floor doing the chores and getting up again and again, what 180 years 70 years before we used to do it, is also the squatting or weight bearing exercises. And if your knees are really healthy, you can always use stairs than elevators, राइट? मतलब दिन में हमने कम से कम 15 से 20 बार हमने उठक बैठक हो रहा है क्या चेक करना चाहिए. We should check every day how many times I am doing sit to stand movement. It is very important because this movement automatically increases your buttocks health, your quadriceps, your gastrocnemius, your hamstring muscle. I means lower limb strength. Only the simple sit to stand. But what I see in the clinic, it is very tough to get up from the chair, right? So don't undermine the movement sit to stand, and it should be definitely pain free, right? So whenever you get the chance to buy the vegetables, the grocery, right, the small things, and try to take a small walks also. They don't take two-wheelers or a four-wheeler. This is a very important aspect for living fit. I repeat, please give the importance to your daily movements. Now the second M is the exercises. Yeah, now again there is a twist, because see, you have balance plate eating. The same way, there is a balance plate exercises. What does it mean? Means you need a strength and stability. To remain fit, you need 7 things. One is a strength and stability, as flexibility of the muscle, because post 40 your ligaments, your collagen fibers become tight. So you need a flexibility exercises. You need a balance because nervous system is also getting weak and muscle strength is going down. So you need a balance exercises. Cardio. Why cardio? Because heart is also one muscle. That muscle also becomes weak, and there is a lot of loading to flow the blood throughout, and you get many heart issues. So you have to exercise for the heart also. Breathing, there are 2 things. See, lungs, because of the posture and pollution, day by day your breathing is under stress. Because of these 3 things, your breathing is hampered. So you have to do breathing also, for the stress also, and for your lungs health. Next is the posture. We have added this. The reason is the mobiles. We are using lot of mobile throughout the day. We are on our mobiles, and what happens in the mobile? We slouch. We become like this, and because of that, some there imbalances are created. So it is very important to do the postural exercises also. Next is the mobility. As we have moved from movers to seaters, we have become seaters. Because of that, few joints become very stiff. Hip joint, lower lumbar spine, shoulders, all these, like thoracic. For that, you need a mobility exercises also. When you do all the 7 types of exercises and you are managing your daily activities with vigilance, you are very vigilant every time, so I think we remain fit. So this is about the exercises and the daily movement. The third is the stress management, right? I'm not expert for the stress management, but what I tell my patient, that I'm telling you. First day we did a breathing exercises. Lot of research say if you are in stress condition and if you do breathing, you feel calm, right? A daily sunlight exposure also helps in your stress. Sleep routines, what we talked on the first day, it is very important to keep your sleep routines. Social connections, meditation, especially it helps me. So meditation also works very well in a stress. And the last, what I feel, I have seen number of patients, and what I have seen in the old age is the purpose. What does it mean? Life with meaning. See, if whatever, you are a homemaker, you are a working person, now you are retired, but do something where you add a value either in your family or in your society. मतलब आपको ये महसूस होना चाहिए कि ये मेरे बगैर ये काम नहीं हो पाएगा, or there is a purpose in your life. If there is no purpose, automatically you are a seaters, then you are a stress, sleeps, everything goes. So be mindful for the purpose. At least today itself, take 10 days and write what is the purpose of my life, what is the purpose of my life, and find out the purpose. And from after 10th day, start work on that purpose, because it is very important for your stress management. Then is a sleep. Again, we have talked on a sleep, right? Like sleeping time, waking up time should be fixed. caffeine, uses of caffeine, especially after late evening, gentle stretching and breathing before going to bed, and the most important is uses of phone, at least not to use the phone before 30 to 40 minutes, right? That is very important, the screen, blue screen and all. So that you can take. See, again, I'm not a dietitian, so I can't tell the details of the food, but I will tell something which comes to me every day: mindful eating. Because weight gain is there, abruptly someone will say something to us and we stop skipping the meals. Either we reduce the quantity like anything, or we skip the meals because we want to reduce the weight. Please, please, please don't do this, because it slows down the metabolism. It increases many of the time more craving, and it increases, the most important is the abdominal fat. So don't stop your meals without thinking ki I'm skipping evening or I'm skipping morning, I'm doing this and that. Keep some research beside that. Yeah. And but what then you can do, you can apply Japanese rule, 80% full rule, right? So you don't eat till you feel like my stomach is completely full. Eat only 80% of the food. Like hunger jitna bhi hai, 80% ही खाना खाओ. This allows the hunger hormone to regulate also, right? It prevents overeating. Yeah. And kam khaya to it affects to your digestion also. And especially what I think one is the overeating ka reason is your TV or a mobile. We are watching the mobile or watching a TV and we are eating. So please avoid this also. But then what to eat? We understood what not to do in eating, how much to eat, but what to eat. Day by day, protein is very common. People are telling, Madam, मैं तो protein नहीं खा रही, मैं क्या करूँ and all. But why protein? Why protein is very important after menopause? Because after menopause, your muscle mass, मतलब muscle की ताकत कम हो रही है. मतलब your muscle mass is going down, 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 and protein helps to maintain the muscle mass. प्रोटीन क्या करता है, हमारे मसल मास को रखने में मदद करता है. सो वी नीड अ प्रोटीन, राइट? एनीथिंग लाइक you can ask your dietitians also, but I think legumes, paneer, curd, eggs, sprouts, nuts, seeds, all these things contain the protein. And how much to protein? Usually the rule is जितना वजन है उतने ग्राम प्रोटीन लो. अगर मेरा वेट 58 है या 54 है तो आई विल ईट 54 grams of protein every day. You can divide that, but definitely you should go to the dietitian. And if you have any kidney issues, so you have to go to your surgeons and ask them how much protein I take. Yeah. So next is the fibers. Fibers are very important, right? It supports your hormone to balance a bit. So you can take vegetables, fruits, whole grains, seeds you can take. Next is the calcium. Why you have to be more vigilant for the calcium? Because menopause is coming, so your bones become weak. We are going to talk in the detail tomorrow about the weak bones, but you can because of the estrogen, the bones become porous, weak. So calcium, and like calcium, if you're taking along with exercises and sunlight, will improve your bone health. And the foods like the curd, sesame seeds, ragi, almonds, and the green leaves, they contain the calcium. So you can be again careful when you are eating. You can take everyday calcium food rich in calcium. Next is the control of the sugar. I said lot of craving is there for a sugar, right? And people start eating the refined carbohydrates like the packaged food. They start, right? So please avoid sweets, bakery products, sugary drinks, and packaged food. And don't underestimate the power of hydration also. What happened many of the time, women confuses between thirst and hunger, and they start eating. But hydration also supports your metabolism, right? Hydration is also important and it helps your metabolism. So you can either take simple water, buttermilk, very good, like matlab excellent, I will say, and the coconut water. You can have a habit of taking the coconut water every day also. Now we will start the exercises, but before exercises, I am telling you few rules for exercises, because today we are doing the cardio exercises. In the cardio exercises, you have to breathe out continuously. I am showing, and each exercise we are going to do 30-second 2 set. But if you feel fatigue, you feel breathless, you feel it is painful, don't do both the sets. Or I will repeat, do all the exercises pain free and fatigue free, right? But continuously we will take a break, small break after every exercise, because these are the exercises for your heart. What we I explained you the why heart exercises are also important to remain fit, because if you have a good heart muscle, you can work anything for a very long time. And cardio exercises help us to do the things for a very long time, right? So we are doing the exercises, so be ready. But before that, you should be hydrated. Before, always take care that before we start the cardio, you should be hydrated, right? And slowly breathe out continuously. So why? The reason is cardio requires lots of oxygen. That's why do constant breathe out, so more oxygen will go inside. Yeah. So we are starting the first exercise, 30 seconds, 2 sets. Right? I am doing 30-second. I will show you first the exercise, simple marching we have to do, and breathe out continuously, because every exercise will need lot of oxygen. So start everyone for 30 seconds, first set. Breathe out continuously. Breathe out and do it. Relax, relax for a while. If you are tired in the 30-second only, please don't go ahead. Same exercise, we are going to do it for more 30-second. But if you are breathless or tired, don't do second set. Start second set, 30-second. Breathe out continuously. Relax. Now the second exercise I will explain, but you can breathe in and breathe out in between. So the next exercise, if you don't have a good balance, please don't do it. Otherwise, you have to touch the opposite heel from the back side. You have to stand erect, touch the opposite heel from the back side. We will do this for 30-second 2 set. So start doing and breathe out. Breathe out continuously. Try to touch the opposite heel from the back side and try to keep the spine straight. Spine straight. Try to touch your opposite heel from the back side. Relax. Again, we are going to do the second set, but as I said, if you are tired, don't do. Start. Breathe out 30 seconds. We are going to do. Try to touch the opposite heel. Relax. Now the next exercise is you have to touch the same side, right? Same side of the foot you have to touch, and you have to bend for sideways, and you have to touch the same foot. If it is not possible, you can touch the thighs or the knees, whatever is possible, because it depends on your flexibility. आपके flexibility पे depend करेगा. हम करेंगे 30 सेकंड के 2 सेट. शुरू कीजिए. फर्स्ट सेट. Breathe out continuously. Cardio exercise need lot of oxygen. Bend in a pain-free range. Relax for a while. You can do 1 or 2 deep breath. Again, do it for 30 seconds. Bend sideways. Do breathe out continuously. Pain-free range. Relax. Next exercise we'll do. Here you have to go little forward and just imagine कि आप कोई झाड़ से फल pluck कर रहे हैं. You have to imagine you are plugging some fruit. You have to go forward, and your backward leg, only heel is getting lifted. You are picking something, so diagonally you have to go forward and try to pick something, and constantly we have to do this exercise. 30 seconds, 2 counts. Start everyone. Going forward and trying to pick up something above shoulders, overhead. You're trying to pick up something overhead. So the leg which is behind, you are lifting the leg or you are lifting your heel. Breathe out continuously. You are doing for 30 seconds. First set of 30 seconds. Relax. If your balance is not good, please do it slowly. Now we'll do second set, same exercise. See, in this exercise, we are not only strengthening our heart muscle, but along with that, we are working on our balance. We are working on our weight shifts. Breathe out continuously. Relax. Can breathe. Next exercise we'll do. You have to hold your both the hands on a waistline. कमर पे दोनों हाथ रखे and rotate to one side and throw the opposite leg. यानी अगर आप left rotate हो रहे तो right पैर throw करें, right rotate हो रहे तो left throw करें. Means rotating and throwing the opposite leg. And this will again do for 30 seconds. Start everyone and breathe out continuously. 2 set will do. In this exercise, along with the strengthening our heart muscles, we are working on our knee quadriceps exercises. We are working on turning and twisting, which is our daily life movement. Relax. You can breathe once. Breathe in and out. Now do the second set, same exercise. Relax. Next exercise, and you will do one more. You do breathe out and breathe in. Now, the next exercise is you have to go back, like spine straight, and you have to go back and do it 30-second, 2 set, right? So start first set of 30-second. Keep the spine straight. Breathe out continuously. We are working on our heart muscle, but along with the heart muscle, we are working on our buttocks. Buttocks health is very important for standing, walking, climbing staircase up and down. Relax. Once, do again, deep breathe in and out. Again 30-second, same exercise, spine straight, going back, right leg back, left leg back, touching only toes, not heel. And, and as I said, we are working on our heart muscle as well as gluteus maximus muscle, means buttock muscle, even our gastrocnemius muscle, hams muscle. Means with the heart, we are increasing. Next exercise means we are increasing our lower limb strength also. In the next exercise, what we have to do is, if you are feeling breathless, you can wait a while and you can do breathe in and breathe out, breathe in and breathe out via nose. So immediately you will feel fresh. In the next exercise, you have to shift the body weight sideways. First, we shifted the body weight forward. Now you have to shift the body weight sideways with both the hands going up to one side and to another. And you are twisting only your feet and moving to right and moving to left along with the breathe out. You are twisting from your ankles. Start first set of 30 seconds. Do it. Breathe out continuously. You are shifting your body weight from ankle. See, you are working with your muscles around like tibialis anterior, which is important for walking. Relax. You can once breathe in and do breathe out. Now do it for again 30 seconds, same exercise. फिर से same करो, shift करो body weight right or left. पंजों से करो. स्मूथ होना चाहिए, झटका नहीं. ब्रीद आउट करिए कंटिन्यूअसली. हम हमारी हार्ट मसल के साथ साथ चलने के लिए लगने वाली टिबियालिस एंटीरियर मसल को भी मजबूत कर रहे हैं, गैस्ट्रोनोमियस को भी कर रहे हैं. Relax. Next exercise, you can breathe in and out once. Now the next exercise is try to lift the leg and touch the opposite hand on the thigh. So this exercise is also sometimes tough because already our heart rate has gone up. So you may feel a little breathless, then that is okay. So what we have to do for 30 seconds, we have to touch the opposite thigh and continuously breathe out. So start first set of 30 seconds. In this exercise, we are strengthening our heart muscle, but along with that, we are strengthening our hip flexors. This muscle is required for sit to stand movement, stair climbing, walking fast, turning in the bed. Breathe out continuously. We need a lot of oxygen in the cardio exercises. Relax. Do once, breathe in and breathe out. Do again 30 seconds, same exercise. Try to touch the opposite हाथ थाइस को टच करने की कोशिश, पर स्पाइन स्ट्रेट रखे. इस एक्सरसाइज से सिर्फ हम अपना हार्ट का मसल मजबूत नहीं कर रहे, बट साथ ही में हम अपने हिप फ्लेक्सर्स यहाँ पे बैठे हैं जो उन्हें भी मजबूत कर रहे हैं. चलने में, उठक बैठक में, करवट लेने में, सभी में ये मसल हमें मदद करते हैं. एक साथ दो काम. Relax. Do a next exercise and do once one. Breathe in and breathe out. This exercise is a little tough. If you are old, you can skip. If you don't have a good balance, you can skip. Or you can do only the first set. See, under the thigh, you have to clap. You have to bend a bit and clap under the thigh. We will do 30 second, 2 set. But if you have a back pain, not to bend forward, please avoid this exercise. Start first set of 30 second. Do breathe out, breathe out. Start. Breathe out continuously. Lot of oxygen is required in this exercise. We are working on our hip rotators. Because of sitting, our hip rotators are weak and tight. Relax. You can do 2 times breathe in and breathe out because this exercise is really tough. Start again, 30 seconds. If you are tired, please, please, please don't do. पैर ऊपर उठाइए, ताली नीचे बजाइए. हमारे हार्ट के मसल्स के साथ साथ हमारे हिप रोटेटर भी ओपन अप भी हो रहा है और मजबूत भी हो रहा है. Relax. Next, we are going close to the now ending, but still there are 2-3 exercises. If you are tired, you can stop here. See, I'm also feeling breathless. You are also must be feeling breathless because we are working on our heart muscle. So the next exercise is you have to bend the knee and put it sideways. थोड़ा दबा के डालो पैर झटके. With the jerk you can put, so even your bone muscles will be also activated. So one right and then to left. Bend the knee, go sideways to right and to left. Put with little force. And we'll do it for 30 seconds to set with breathe out. Start. Continuously breathe out. If you don't have any pain in the knees and the back, then you can put your leg with force. If you have, then put it gently. Relax. Once again, breathe in and breathe out. Our heart rate is rising, rising. Again, do it for 30 seconds if you are comfortable. अगर आपको तकलीफ नहीं हो रही तो आप जरूर कीजिए दूसरा सेट. घुटना मोड़ के साइडवेज ले जाइए. अगर आपको कोई दर्द नहीं है तो आप पैर जोर से रख सकते हैं, नहीं तो आराम से रखिए. पैर जोर से रखने से आपकी हड्डियां मजबूत होती हैं. इस एक्सरसाइज में हम सिर्फ हार्ट की मसल्स ही नहीं, हमारे हिप एब्डक्टर, वन ऑफ द कोर मसल को भी मजबूत कर रहे हैं. Relax. Next exercise, Now what we have to do is, please slow down. Now we want our heart rate to go down, so our speed should be less. Kabhi bhi always increase the heart rate and reduce the heart rate. So in the next exercise, you have to just go front, touching only heel, khali edi ko lagana hai, and spine straight, and very slowly, because I want now your heart rate should go down. We'll do 30-second to set. Start, everyone. Back straight, right leg ahead, then the left, only touching your heel. Spine straight. Breathe out continuously, but the speed is slow. We want our heart rate should go down. So there are some rules for your heart exercises. So, but still we require a lot of oxygen. Relax. One, breathe in and breathe out one time. Again, do same exercise for 30 seconds. Slowly do it. You will feel now less breathless because heart rate is going down. Relax. Now, next exercise is breathing. Now we want our heart rate should go completely normal. We can't leave our heart rate in between. So what you have to do is, you have to sit, keep one hand on the chest and other on the abdomen. Breathe in via nose, breathe out via mouth, or whatever practice you have. But when you breathe out, your tummy should go inside. There should not be any movement in the chest. I repeat, when you breathe out, your tummy only should go inside, and breathe out should be longer than breathing. So we will do it, this exercise, for 1 minute continuously. And close your eyes and please do it. Try to feel the heart rate, धक 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 कम हो रहा है क्या. Spine straight, chest open. Breathe in via nose, breathe out via mouth. Breathe out should be longer than breathe in. Relax. Now the next is the, like, next exercise is, yeah, just breathe in and breathe out via mouth. Like, breathe in, shoulders up, breathe out, shoulders down. Same rule of breathing we'll do. We'll do it for 1 minute. Start, everyone. Close your eyes. Shoulder up, 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 and breathe out. Shoulders down, down, down. Spine straight. Relax. And now our heart rate is completely now normal because we did today cardio. The reason is endurance. Heart muscles gives us endurance. What does it mean? उसका मतलब क्या है? हम कोई भी काम लंबे समय तक बगैर थके कर सकते हैं. That's why we did today cardio and without instrument and sitting at our home. That is the most important. So here we finished our exercises, completed our exercises. Now today's gold standard test is, see, daily we are doing some gold standard test. We use a functional test. Today we talked about sit to stand movement a lot, right? I said you should do at least baseline is 20 sit to stand in a day, right? Means the movement, let's say for example commode or something like that, because this is a very important functional test. And we do this, we use a functional test because we are doing this movement like getting up from the bed, again getting up from the chair, getting up from the toilet seat or a commode, rising from the floor. All the time we are doing sit to stand. But is it, muscles are okay? Are the muscles ready for this? Or are we fit for this test, for this moment rather? So what does this test actually predicts? Basically it reflects, I said, only this movement increases your quadriceps strength, hamstring strength, your buttock strength, and your core, what I explained you, it stabilizes in this movement. So actually this test reflects different muscles are in a good condition or are not. It also predicts our balance, right? Because if the muscles are not good, if the core is not stabilizing, then there is a risk of fall even in this movement, especially after 75. We have seen many cases mein uthne gaya aur gir gaya, right? That is a neuromuscular coordination also and reaction time. So this is a very important test for especially 75 plus. But why I will tell at the 40 also, the reason is at 40 you can do much, right? So this is the test. I will show you how to do it, and these are the readings, but don't see the readings. What is a test? See, you have to sit not only on a very short stool but a medium sized stool, and what you have to do is you have to just get up and completely get up and completely sit down. You have to get up completely up and sit down. Don't do, and how many times you can do this in 30 seconds? You have to count like 1, getting down up मिला के 1, then 2, and you have to count how many times you can do in 30 seconds. So these are the scores, they are given, they will put it in a chat. And this test, I think it's very important for everyone. Don't feel that at 40 it is less, because people are now sitters. So at the 20, at the 30, we have seen the score is not to the mark. This is very important functional gold standard test. Yeah. Thank you. Yeah.
Thank you so much, ma'am, for doing today's session. And wanted to understand from everybody, did you understand the gold standard test? Do you want us to repeat? आपको समझ आया ना आज का गोल्ड स्टैंडर्ड टेस्ट? आई होप आज पूरे दिन आप ट्राई करेंगे या फिर आप कल ट्राई करेंगे और हमें बताएंगे हाउ मेनी टाइम्स इज इट ओके फॉर
Scores
यू टू
are
डू.
also coming. That's so nice. Yeah.
Perfect. Ma'am, we have a lot of questions pending, so we'll start with the questions and
Yes.
then we'll take some from here. When I stand for 10 to 15 minutes while talking to someone, my calf muscles start hurting and I feel like sitting down. Also have flat feet. I am 42 years old.
So first thing is check your BMI, body metabolic index. If the weight is more, again it will affect your calf muscle, that is a gastrocnemius, right? If you are a homemaker, then what happen usually, if you're standing for a long time, your calf muscles are already tight, right? And you said you have the flat feet. Yesterday also I said, usually if you have the flat feet, if you are noticing flat feet, now they are not a flat feet, they are pronated feet. Flat feet, that is, we diagnose it at the age of 5 that you have a flat feet, right? So that is, the arch is not developed, that is something different, and arch is collapsed. So arch is collapsed is something different. For that you have to strengthen your core, you have to strengthen your lower limbs and arches also. You can strengthen even your arches also.
Perfect, ma'am. Ma'am, the next question is, while doing urine, do muscles in and out to strengthen it, or it is a wrong practice? So while
Not an
urinating, while
uh
urinating, should we contract and relax our muscles while the process
no.
is going on? Does that strengthen it, or is it a wrong practice?
Ideally, there are 2 3 rules. Never practice in the morning, first urination, because lot of bladder is full, you will weak your muscle. Second thing, to understand the perineal contraction, in a day only you can do 2 to 3 times once, and in one only 2 to 3 repetition, not more than that, because there is a lot of loading of the water and you are trying and you don't have a muscle. So मतलब अच्छा होने से ज्यादा खराब होगा. What I said, if you don't have a pain, if you have a knee pain, you lie down and do exercise. For the same way, when you are urinating, please don't do exercise. And if you want to do it, for example, don't do in the morning, you can do in afternoon and late evening, but only do 3 contraction to feel it, what is mean by perineal contraction.
Ma'am, the next question is, I am 39 years old having stress incontinence. While taking along with exercise, will taking collagen supplement help? If yes, please suggest one.
I can't prescribe collagen supplements. That is only prescribed by gynecologist and orthopedic surgeon, so I can't prescribe now. It helps, but still I will tell you, any collagen supplement is the just 20%. Rest is overall fitness, we are talking from the first day, right? Because I have done this without the supplements also. If you do regular proper scientific exercise, it works. But definitely you can take a collagen supplements, but not without a prescription of either a gynecologist or a physician or a orthopedic surgeon.
Ma'am, the next question is, for foot, I think we said. So I have a query for Dr. Sheetal. She said that the arch is fall as per age and not having right foot, etc. What is the best exercise to redevelop the arch? If you could, yeah, explain.
Yeah, it is the same. See, I will tell you, ऊपर से वजन नीचे जा रहा है, body weight, core is not good, so that core is putting weight on the hip is not good, hip is putting the weight on the knee is not good, it is putting the weight on the ankle, and your arches collapses, right? So only working on the arches will not work. You have to start from the core to the end, first thing. Second thing, definitely we can work on the arches, we can improve the arches with the exercises and a correct shoe. Because if whole day your arches are going flat, then it will take too much of time. So we tell the patients to strengthen the do the exercises, along with that wear a good shoes.
All right, ma'am. The next question is, when pelvic exercises are being done 20%, our abdominal and back muscles are also activated. Is it okay?
No, we explained this for 2 minutes continuously in the starting. 20% of contraction of the pelvic, but no activation of the contraction of the abdomen and the buttocks. You can try this daily. Maybe after 10-15 days, you will start feeling the correct contraction, because I know this is really very tough.
Ma'am, the next question is how to improve one leg balance golden test. I think regular practice will help strengthen, right, ma'am?
Yeah, yeah. Whatever I'm saying again, same thing, core and lower limb strength and
The next
flexibility
question.
and mobility.
I am 66 years old. Often while walking, the toes of my right foot get curled, especially the big toe and the first finger. What could be the reason and remedy?
Reason is, one is your buttocks are weak, second is your quadriceps are weak, and third is your hip abductor, means the muscles are sideways of the hip, they are weak. And because of that, there is extra loading coming on your toes, and because of that, they are curling. And the reason is the same what I said. Start working on the core and hip, knee, ankle, chin.
Can you please guide me how to do balance test as shown in 9th of March? You can refer to the recording, and if there is a doubt, the team can help you. Um, Two questions, ma'am. First, are bunions due to posture error? Can they be corrected with any exercise? Second,
I think, yeah,
if there were a few exercises which we should not do, how do we correct it?
I think I have answered this question, but again I will answer. It depends on the gravity, how much deviation is there. Now there are surgeries also. With exercises, you can't correct the deformities completely, but functionally people are pain free. But again, if it is too much, so day by day, exercises, footwear, and surgery. These are the three options. But it depends on how much is the deviation of the toes, right? So yeah, great. How much deviation is there? It depends on that.
Ma'am, there's another question. How to measure arch on our feet?
It is very technical. Actually, I don't know whether we can tell what you can see, because there is a, we say the navicular drop and everything. It is very technical. But only thing what you can do, you can see your foot when you are lying down is the three arches. I explain you, there is one in the foot, there is, I will like, the foot one arch is from the inside great toe to the heel, then from the little finger to the heel, that is the second arch, lateral arch, and all the toes the front, that is the anterior arch. You have to see that is there any collapse in that, या ऐसे पैर फैल गया है क्या, you can see that, right? If the lateral arch is obliterated, what you can see the great toe and heel line, you can see the muscles going out. So that you can, because all this is very technical.
Okay, ma'am. What to do if one has endometriosis?
Actually, I think this is a question for gynecologist.
Feet feel cold in summer. Even sometimes have to wear socks at night to have comfortable sleep. What could be the reason and how to correct it?
Can you please repeat the question? Not understood.
Feet feel cold in summer. Sometimes even have to wear socks at night to sleep comfortably. क्या रीजन हो सकता है, कैसे
हाँ,
करेक्ट कर सकते हैं?
एक्चुअली ये ना हार्मोनल इम्बैलेंसेस से भी होता है, बट मुझे लगता है एक बार गायनेकोलॉजिस्ट को दिखाना चाहिए, मतलब बिकॉज कोल्ड फीट हो सकता है, यू हैव टू रूल आउट डायबिटीज ऑल्सो, अनकंट्रोल्ड डायबिटीज, सो मेनी थिंग्स यू हैव टू रूल आउट. आई थिंक यू नीड अ कंसल्टेशन विद अ डॉक्टर, गायनेकोलॉजिस्ट.
The next question is how to improve test score. It is by practice, by continuously taking care of yourself. Your flexibility will improve, mobility will improve, and it will be there. Ma'am, the questions from that chat we have already picked up. Do you want to pick up
Yeah,
some questions from this chat?
yeah.
Um, my age is 47. I have pain in both my legs, have visited many orthopedics, yet my condition is not improving. I have tried everything, did physiotherapy as well. Now have been, you can reach out to the team personally and request for a physiotherapy consultation. So somebody from the physiotherapy team will connect you to a physiotherapist and you can try it out there. Good exercise for blood circulation in feet.
good exercise for blood circulation in feet. And the first is you need a very strong quads, hams, and calf muscle. One thing, right? And a weight management.
Ma'am, the next question is I can't sit in Sukhasan, that is cross legs. What can I do?
I think there is one adductor muscle. First is your lower back. Day by day, our we are more seaters, so lower back flexibility is going down and down. So work on your lower back flexibility, and there is like we use the word a short adductor stretch. It means you can lie down and do the figure of four, and you try that, and I think slowly you will get a result. But it is a very tight muscle. You will see the difference in 3 4 months.
All right. 50 years old. I have 5 centimeter uterine fibroid. Figo. Yesterday I did Kegel. Today I got my periods after 18 days. Is it normal?
I think this is a question for gynecologist. Yeah, I
Just.
don't think I should answer. Yeah.
I had umbrella hernia repair 5 years ago. Which exercise could I not do? I think you should reach out personally to the
Yeah.
physiotherapy team. They will be able to answer. When I am 52 years old, when we do breathing exercises, I am comfortable breathing in and out with nose only. Is that fine?
It is totally good. You can do that.
Please show hypertonic exercises for pelvic regions as Kegel exercise is for loose muscles.
Can you repeat?
Please show hypertonic exercises for pelvic region as Kegel exercise is for loose muscles.
No, 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 no. This is you have misunderstood the reason. There are two types of fiber. I yesterday told the small, fast twitch and slow twitch. So the same exercise, you have to hold it and you have to do just the contraction. We did both yesterday, right? So you misunderstood. So it's the area perineal muscles only, and few exercise. Usually we check in detail, but what you can do as a thumb rule is few times you do contraction and relaxation, and few times you can hold it for 3 4 seconds or 7 seconds.
Ma'am, there is a question on restless leg syndrome. If you can talk a little bit about RLS.
Rest like syndrome, like many of the time, there are 2 3 things. The emotions are like anxieties are also associated. Rest leg syndrome, muscle tightness are also associated with that, right? Matlab, in the detail, it will take half an hour, but just superficially, I can tell. And the third, I think you can work on your hydration also, right? But mostly, what I have seen is one common thing all restless leg syndrome is overall your strength and fitness is not good, first thing. Secondly, emotional health is a challenge, right? All together gives these symptoms. So we usually break down everything and then we work.
मैम आई थिंक वी विल रैप अप. आज बहुत सवाल हुए हैं बट हम आज का सेशन रैप अप करते हैं. वी विल सी यू अगेन टुमारो. हम लोग 10-15 मिनट कल भी जल्दी कनेक्ट करेंगे. टुमारो इज द फाइनल डे ऑफ द वर्कशॉप, सो वांट यू ऑल टू कम ऑन टाइम ताकि हम लोग बहुत सारे क्वेश्चंस ले सके. एंड उसके बाद वी विल ऑल्सो do our session which is planned for tomorrow. So tomorrow is day 5 which is the last day. And आपके जितने भी सवाल होंगे यू कैन ऑल्सो सेंड इट ऑन चैट टू आवर सपोर्ट नंबर. तो जिस नंबर से आपको योगा लिंक्स आते हैं आप वहां पर अपने सवाल भेज सकते हैं. अगर आपका कोई क्वेश्चन आंसर नहीं हुआ है वी विल पिक इट अप एंड वी विल आंसर इट little bit earlier than the session. So that's it. Thank you so
Yeah.
much, ma'am, for being
Yeah.
here, for taking today's session and speaking on such an important topic. आज का टॉपिक बहुत ही ज़रूरी है क्योंकि हमारे आसपास बहुत विमेन होते हैं जो मेनोपॉज और वेट गेन के इशू से गुजर रहे होते हैं, तो आई थिंक वेरी इंपॉर्टेंट कि
Yeah.
ये इसके बारे में सबको इन्फॉर्मेशन।
So thank you so much, Yamini. Thank you everyone for listening me. But tomorrow we are going to talk about the bone health. But please understand there are so many pillars for the fitness. My purpose is that we have to understand there are many pillars and every pillar has to be fixed and we see the good health. Thank you so much.
Thank you so much, ma'am, for today's session. Really grateful for your wisdom, for your patience, and for all the explanations you do. Thank you so much. Looking forward to tomorrow's session. That's it. That is day 4 of the workshop. I hope आपने कुछ नया सीखा, आपने enjoy किया आज का सेशन, एंड हम आपसे कल मिलेंगे। सेशन रिकॉर्डिंग जो पहले के हैं, जो आज के हैं, आपको सब मिल जाएंगे बाय एंड ऑफ डे। जो पीडीएफ्स है जो मैम शेयर करते हैं स्क्रीन पे, वो भी आपको मिल जाएगा। गोल्ड स्टैंडर्ड टेस्ट इज पार्ट ऑफ दिस पीडीएफ ओनली, तो अगर आपको पीडीएफ में आगे आगे जाते रहेंगे तो आपको गोल्ड स्टैंडर्ड टेस्ट भी मिल जाएगी। Thank you so much for being part of today's session. Really grateful, and I will see you tomorrow. Till then, please take care and namaste.